What I'm about to show you now is a workflow that makes use of CareRight's smart forms, workflow control, and task management process. And in this particular case, we are billing for bedside activity with a patient. This can be done on any type of internet-enabled device, an iPad, an iPhone, or a computer. And in this particular scenario, we're imagining a care provider is going to the patient at the side of their bed and registering information. Now, the way we've looped this particular bedside billing in is related to cases. So obviously we could do bedside billing unrelated to cases, but it's a nice demonstration of our case management process as well. So you'll be able to see my screen here, and as you can see, I'm in Robert Hopkinson's profile. If I just go down to the Cases and Programs tab in his account, I can see, because Robert is a new patient, we don't have any cases registered to him yet. So I'm just going to go to New, and I'm going to register a new case, which will be infectious disease. The location is set to the Clintel Centre, and now we're going to go Open. So now you can see we've registered a new active case towards Robert Hopkinson. Now I'm going to hit Show. And this is opening up that case, and we can add as many events, assessments, appointments, or even clinical notes to this case that we want to. What I'm going to do is I'm now putting myself in the shoes of the clinician at the bedside, and I'm about to undergo a bedside consultation with the patient. So all I have to do is open up the case, go to Assessments, and open New. Now, this is the first time we've done any activity regarding this case for Robert Hopkinson. So you can see there's no historical issues there. This is where we would update the issues and put in our consult notes if we wanted to. Just for demo purposes today, I'm going to say notes pertaining to activity. I might say consultation, assessment number 1. Okay, and now at this point, for this first consultation, I can put in any billing item numbers that I want. I'm just going to put in some random ones here. As you can see, I can put in more than one. It's already pulled in that we want to bill the health fund, Robert's health fund provider in this case, and we're going to say yes, the payer is a health fund. This assessment can be whatever you want it to be. You can make use of CareRight's full smart form capability with a series of drop-down boxes, free type boxes, radio buttons. And as you can see, I guess a good illustration is when I put in a new item number, a new box opened, these smart forms can open up new sections dependent on what a previous answer was. I'm just going to put in notes, see again in 2 days. And now I'm going to hit approve. So upon approving that assessment, we've then locked that into the clinical notes. It's also been assigned to the case of infectious disease for Robert. If I wanted to go back in there, I could hit show. Alternatively, I could archive if I wanted to, but being a clinical record, you can never delete anything. We're now imagining that we're 2 days later, and we want to do the next clinical assessment on Robert. So now I'm going to hit new, which opens up the next assessment. As you can see, those previous issues have come through, and it's also copy and pasted into today's activities, which we can make use of if we want. My notes today are going to be further assessment, case is looking worse. And now I might put in some other billing item numbers for today's activity. Now I can hit approve. Okay. And now you can see that we collect assessments which are assigned towards this case. The other thing to note is every time we're putting in billing information, it's collecting under events. I'm just going to do one more activity. Let's pretend we're 2 days later and we're going to do the same assessment again. You can see it's pulled through our last clinical notes. I'm going to say now, case complete, close, just for an example. Put in some billing item numbers again. And I'm going to say, yes, this is the final consultation. Principal diagnosis, I'm just going to put something in here just for an example. Appointment required. If we answered yes here, this is a great illustration of CareRight smart form capabilities and workflow. If I actually clicked yes here for appointment required, this would send a workflow to the admin team. There would be a task to ask the admin people to book this patient in for an appointment. But for today's demonstration purposes, I'll say no. If I wanted to refer this patient out at this point, I could. And now I'm going to hit approve, which finalizes that case. Here's everything that we need to see about it here. If I hop out of the cases and programs file and go to Robert Hopkinson's clinical notes, you can see all of those assessments that we undertook have come in here and saved within the clinical record of the patient. And let's just say we did 12 months worth of activity for this patient. As you can see, to look up historical records, I can search by category, discipline user, or in this case, I'd probably want to search for case, which would be that infectious disease. Last thing we want to do is if we go out to the dashboard, I'm now pretending I'm an admin person and I'm going to events. I can go down and see I have a new event for Robert Hopkinson. There's 3 events, which means there's been 3 assessments that have had billing item numbers put into them and then approved, sent for billing. So pretending I'm an admin person now, I can hit show. I can look at all of those billing item numbers. If I wanted to select all of them, I can do that very easily. If I wanted to add an additional one, all I'd have to do is click on new here and put in another billing item number. And then the last thing I would have to do is click invoice and take payment. And that would be conclusion, both clinically and then billing and claiming for the case of infectious disease for Robert Hopkinson. Thank you for your time.